ensures that we keep you updated with all the latest happening from politics to matters of society. And today we take a spotlight on a silent crisis that is affecting Kenyans, millions of Kenyans, diseases that rarely make headlines but yet continue to steal sight, sometimes even dignity and even productivity. What am I talking about? Neglected tropical diseases, or NTDs as they are famously known, where poverty and poor sanitation thrive and safe water and weak health systems intersect. That is where you find about this. But have you ever heard of them? Which are the neglected tropical diseases? From maybe you've had trachoma, some of the diseases I've seen here, lymphatic filariasis, but I'm not the expert here. We have the experts in the house to help us to delve into that. And something else that I've been able to pick up is that we want to do away with NTDs, at least one or two, by the year 2030. We have 4 years. Where are we on that? But without further ado, allow me to introduce my panel of experts, bearing in mind that this coming Friday, that is the 31st of January, we are celebrating World Neglected Tropical Diseases Day under the theme, we'll be telling you about the theme, we'll be looking at that on the second part of this program. But on my immediate left, and let's begin from my extreme left, we have Dr. Joyce Osongo. Dr. Joyce is the technical advisor for NTDs, that is neglected tropical diseases at World Health Organization, WHO Kenya. Karibu sana, Doc.
Thank you very much.
And thank you so much indeed for making time.
Thank you, I appreciate it.
Just next to her, we have Jane Njomo, who is the project manager at WASH Alliance Kenya, which is representing the critical link between water, sanitation, hygiene, and disease prevention at community level. Karibu sana, Madam Jane.
Thank you very much. Thank you for having us.
Karibuni. And maybe for the interest of Kenyans, and also enlighten us more what we are talking about when you talk about NTDs, or the neglected tropical diseases.
Thank you, Ben. Good morning, viewers and the panel. Thank you for hosting us. As you heard, my name is Joyce Osongo. I am a medical public health expert in the area of communicable diseases, and now focusing on the neglected tropical diseases at the WHO Kenya Country Office. And with this particular day, I'm very happy to talk about the neglected tropical diseases because actually, Ben, the neglected tropical diseases, we call them neglected, but actually it is the neglected people. These are a number of diseases, very ancient diseases. They are really not new, but they have affected millions of population. In fact, we say now in Africa, in the world, there are about 1 billion people at risk of these neglected tropical diseases. But they affect the poor, and that's why these people are neglected, because there is no major budget, there is no voice, and nobody really looks at them. It is the poor. Actually, our Director General in WHO, former Director General, Dr. Margaret Chan, say that the neglected tropical disease starts where the road ends. So when the road ends, the diseases start, meaning it is the very end of the road where there's poverty, no sanitation, no access, and the people are poor. And we have a number of them. You have talked about lymphatic filariasis, you have talked about trachoma, you have talked about onchocerciasis, ecalaza, which is leishmaniasis. There is also schistosomiasis, soil-transmitted helminths. There are about 21 that WHO has listed as the neglected tropical diseases in the world. But each country has, like Kenya has highlighted about 10 that are very focused. And I want to say that these are a number of diseases that are mainly caused by viruses, they are parasites, fungi, toxins. They have various diseases that are put together, because the strategies are related. But I want to say that as WHO has given a global roadmap. It's called the NTD roadmap, ending the NTD 2030. Meaning at least each of the countries that are having these diseases, you should eliminate at least one by 2030. If you can do more, it's better. And I want to say that in Africa, there has been a lot of progress, but there's a lot of work to do. At least 19 countries have now eliminated at least one neglected tropical disease from their community.
Have we as Kenya?
Kenya is on track. We have eliminated 2. So there is guinea worm was certified free Kenya was certified free guinea worm in 2018, and congratulations. We really give a lot of thumbs up to the government of Kenya and the people of Kenya for having this milestone. And just last year, 2025, June, Kenya was validated to have eliminated what we call sleeping sickness, human African trypanosomiasis, free elimination. It was actually elimination as a public health problem, meaning the cases are so low that you cannot be a public health problem. And therefore, Kenya is on track also to eliminate 2 more by 2027. That is lymphatic filariasis and trachoma. That is the blinding trachoma. And if Kenya reaches these goals, you can imagine the burden we remove from our communities, and they are free to live quality life and do the economic activities. Yes.
Jen, allow me to pick where Doc has left in regards to where the road ends, that where they begin. And I'm looking at why poor sanitation, poor water and hygienic conditions are so closely linked to NTDs, especially in communities.
Thank you. Once again, my name is Jane Jomo, and I manage the project in the Western Kenya region. So we are mainly in 4 counties that we refer to as the DIF counties. That is under the program that is funded by NFund. We call it DIF because it's abbreviated to mean Deworming Innovation Fund. So this is a fund that comes in to support in the elimination of the neglected tropical diseases. We are a partner, we are 3 partners that work together. So we have AMREF that does the treatment. We have AHD, that African Institute for Health and Development, that does the social behavior change communication, and WASH Alliance comes in to bring in the water sanitation and hygiene component. Now, coming to your point, WASH Alliance works to provide services to be able to support these vulnerable and marginalized communities. Like Dr. has said, it is key that we start at the bottom, at the grassroots, because these are things that if behavior is improved, simple practices like proper use of latrines, simple hand washing with soap, and stopping of cultures and practices that are linked to these illnesses, we are able to eliminate these NTDs. Now, just to mention that there are simple bacteria, viruses, and parasites that if we do these practices like the proper use of latrines, then we are able to create a barrier between the latrine, that is the sanitation, and coming to our food handling. And simple behaviors like handshakes are able to break that barrier in the transmission of illnesses from these sanitation and water storage facilities to the children. Now, coming to these illnesses, let me mention some of the NTDs that we have. We have bilharzia, that is commonly in lake regions and rivers. Then we have intestinal worms, which are commonly among children. We know that in schools, you will find, especially children who do not wear shoes, who walk barefooted. Remember, we are linking this to poverty and vulnerability and marginalization. So among children, you find children that walk barefoot are most exposed to the passing of these illnesses. Then in trachoma, they are prevalent among the arid and semi-arid regions. We know that without water, and there's that passing of especially areas that do not have proper water, and most of these arid regions will have livestock. So there's that passing from for example, flies to the eyes, and that's trachoma arises. Then we have the elephantiasis that is common mainly in the coastal region. In Swahili, we call it matende. When we were growing up, we could see that people had swollen limbs, and this is caused by the elephantiasis, mostly from tsetse flies. Now we finally have kalaza, which is common in parts of northeastern. So like Daktari said, we find a linkage between water sanitation and hygiene and the NTDs. Yes.
Doc, A very valid point she's talking about, especially when it comes to some of these things like bilharzia. Hardly you hear of Kalaza in Nairobi, you know, but in those northeastern region. And the question is, why is it a public health concern in Kenya? And what are some of the symptoms that somebody should look out for? I remember back in the 80s we were looking at, you know, the people who had really swollen limbs. And we thought they were just huge, but it was a condition. But gradually, just like you said, we are almost done with these diseases.
Okay, thank you, Ben, for the question. Why is it that they are a public health problem or concern? The World Health Organization definitely has highlighted some very high, high priority of these neglected tropical diseases to be eliminated. And first of all, they are categorized. They are those for eradication. We don't want them anymore. And this is guinea worm. And there's another disease called yaws, which is not in this country, but it's in West Africa. So those ones, we just completely erase them from the face of the world. Then there are others for elimination. We can reduce them to a level that there is no transmission of this condition. It's possible. And there are others which are elimination as a public health problem, and the others for control. So they're categorized in various categories. There are some you may not eliminate because we even don't understand their magnitude. Let me go to what you're saying, why they are a public health problem. It's because they affect a large number of people, children, adults, and these, for example, let me give an example of schistosomiasis, what we call bilharzia. If you look at bilharzia, if you don't remove bilharzia from children along the water bodies, like mainly in this country, they along the lake region, the coastal area, and where there are water bodies, those children cannot attain their full-grown educational attainability. They cannot have cognitive activities. They cannot get well through the education. So if a child remains behind in the education system, they have already lost in their way of development. So they retard, they affect development, and therefore throughout the life, the child is already behind. When they become adults, the adults cannot produce their economic potential. They are always tied to the poverty cycle. They will not come out. Because of this impact of health, we realize that we need to remove this from the community so that the community can live healthy lives and economically empower themselves. That's why they are of public health concern. They also cause stigma and isolation. This, for example, if you look at the coast area, people who have this matende, they have big, swelling of the legs. Some of them have swelling of the genitals, what we call hydrocele. They don't even come out in social activities because they feel isolated and ashamed. This is not something that should stay in communities. Communities should, and there are tools, another thing. There are tools that they are there to remove. You see, if there were no tools, we could say, we don't know what to do, but we know what to do. So why not then do it and remove this suffering from people? This is why they are of public health concern. Thank you.
Yes, you wanted to add something.
I wanted to mention something about some of the symptoms that will tell us that NTDs are monsters, and some of the symptoms would be like stomach pain. We may also have cases of diarrhea, and in some cases you'll have blood in urine. So it is not necessarily that this is bilharzia, but just to be safe, it's good to be checked out to establish that bilharzia is not there. And then another case in trachoma, there's a lot of eye infection, which if not treated may lead to blindness. So there's the swelling of the limbs, like we have mentioned, and then there's skin sores, vidonda, and discomfort. Then we would also have fever and fatigue, because this is something that's draining you. And then we would have blindness, where trachoma is not treated in good time. And if these cases advance to high levels, it leads to permanent disability. So people, like we've mentioned, become unproductive in the community because they cannot work. So they are not productive, and in the case of stigma, you find even in schools, children may not want to go to schools if they have jiggers, because they cannot play when other children are playing, and other children look at them like they are cursed. We know the issues of culture are very strong in some of our communities. So these members may be isolated and no one wants to associate with them. And that's why it's important that we respond and handle these illnesses so that they are able to be gotten rid of, and these society members become productive members of the society. Yes.
And something disturbing is that both of you are talking about these diseases are not only preventable, they are curable. You know, we are not talking about the same way we talk about we had COVID, the same way we're talking about tuberculosis or HIV and AIDS or even cancer. Yes. They are both preventable and treatable. But unfortunately, if you look at what we are having right now in the country, and just like you said, where the road ends, that's where it begins. Unfortunately, we are not doing enough to do. Are the policies, the county governments, are they really keen on eradicating this? If we have to beat the deadline of 2030, and there's the one that we put up for ourselves, 2027. Yeah.
Thank you for that question, Ben. Very interesting. Are we committed to end these diseases? I believe first that as WHO, we know we have made the policy, and because it's doable, that's why the policy is there. If it were not having the tools and the medicines and the knowledge, then we will not have the target. So yes, it is doable to end these diseases for NTD. However, what does it require? It requires commitment. Number one, policies at highest level. That is the national government, the county government, the communities, all the way to individuals. We've got to take responsibility. And I want to commend the Ministry of Health through the Neglected Tropical Disease Program that has set a strategy 2027 to 2023 to 2027. There is already a roadmap to end. So that is number one commitment. If you don't have a strategy, then where are you going? But we have a focus of ending these diseases, at least until 2027. They have targeted those. Actually, there are 2, or there could even be 3, because there's another one you're talking about, onchocerciasis, which you have not even put it in. So it is possible to end. Another thing, World Health Organization has committed medicines which are given with no cost to the government as much as they need it. These medicines, we call them mass drug administration. We have medicines committed by our international pharma, including the GSK, Merck, and JJ. We have Johnson & Johnson. We have all these pharmas which have come to WHO and said, we can donate these medicines to countries that need it through the World Health Organization, so long as they deliver to those who need it. And we do this every year. Matter of fact, just last year, our regional director, Professor Janabi, provided a donation of about 6.5 million tablets for schistosomiasis and the treatment of zoetrosimase helminths to end. We continue doing this every year to the government of Kenya, and we are happy that the government of Kenya then delivers these medicines to the children and the communities that need it. We are committed that until 2030. If we have these commitments, and also the communities should now take it up and do the hygiene, the sanitation, education. I was in this Migori, let me just give you an example. I was in Migori last year when I was giving the mass drug administration in Migori. Migori was one of the high endemic counties for schistosomiasis. In one of the villages when I visited, the mother told me, oh, you mean this passing blood in urine is a disease? We thought it was a stage which our children pass. All of them, they do that. So I was so touched. I say, look at the knowledge. People think this is normal, but it's actually a disease that is affecting their children. And they were very happy that now they can remove this condition through treatment and hygiene. So it is possible to end these diseases.
Let me pick from where Doc has left in regards to mass drug administration. And question is, why can't Kenya eliminate NTDs through medication alone? And what interventions is WASH coming in with, especially to break the transmission cycle? Because from what I've gathered is that the transmission is also playing a big role in actually denting our efforts to ensure that we are free by 2030.
Thank you for that. And just to mention that, like we are saying, NTDs are both preventable and treatable. So they're curable. But then we need to handle them from the beginning so that we prevent them. And with evidence-based policies and community action. So it's not a one-person responsibility. All of us have a part to play with coordinated efforts. And as much as we have the MDA, Mass Drug Administration, it has to be supported or complemented by simple behavior practices that can be done for us to be able to break that transmission. Now, how do partners come in to support? So partners come in to give support to the government, both the national level as well as the county level governments, through funding and technical assistance. So education, sensitization, creation of awareness on what exactly NTDs are, how they're transmitted, and what communities can do to be able to break that link. Then we also come in with research, because we know you cannot handle something that you do not know how to handle. So we need evidence, we need numbers. So this helps us to be able to plan, to target interventions, and also to be able to identify which areas need more interventions. Then we have the linkage between NTDs and WASH, because we need to see what happens where there is good WASH, are NTDs eliminated? And if they are not, then what is the other factor that is contributing to this problem? It could be the issue of behavior change, because we could be doing the MDAs year after year, but if the behaviors are not changing, then we'll have consistent problem of the same issue. So we need to be able to bring in behavior change so that people use the latrines properly, wash their hands, and ensure that children wear shoes in schools for us to be able to break that linkage. And also community mobilization so that we bring everybody on board. It is not the leadership of the county's responsibility. The communities, the youth, women, we need everybody on board. Like we say, we do not want to leave anybody behind. Everybody has a role to play so that we ensure that once they have the knowledge, then they practice these things, from the parents to the children. So in schools, we have what we call the WASH clubs. So these are clubs that have children who are trained, and we use them through an approach we call peer-to-peer. So they talk to their fellow students, and when they go back, they talk to their parents. And that way, the whole community then is brought on board. Then we have coordination of efforts so that everybody has a part to play. The Ministry of Education, Ministry of Health, Ministry of Water, everybody, even at the department, the county level, the departments work in a coordinated way, so that as much as we are coordinating partners come in, and the efforts they have are not duplicated, so that we have long coverage, we go longer, and we are able to save on resources and time. And finally, the issue of advocacy. Lobbying for budgets, for us to be able to handle these NTDs. We have budgets that are budget holders. For example, at the county, the leaderships, the MCAs, the MPs, they have budgets that are allocated to them. Yet in schools, you find sanitation facilities that are collapsing. So are they willing to commit, even if it's a small budget of this money, for us to be able to renovate these sanitation facilities? So it is everybody's participation that will work towards elimination of these illnesses.
Yes, Doc, I saw you nodding, and I'm looking at some of the things that she's talking about, very practical, because one, advocacy, and even information. You had a case in Migori where the parent didn't even know that the kid is sick.
Yes.
And one thing people should know, that some of these NTDs can kill.
Yes.
Blindness.
Even
maiming.
visceral leishmaniasis actually causes death without treatment.
Now we are celebrating World Neglected Tropical Diseases Day.
Yes.
And you know very well, when we have anything that maybe we are celebrating a day or commemorating a function, a lot is done in between or running up to the day. But after that, that's it.
Yes.
From where you sit, beyond just symbolism that we are celebrating this day, and we have made, also tapping our shoulder, because at least we've been able to eliminate at least one or two, and we are on course.
Okay.
We're talking about 2027 or 2030.
Okay.
What urgent actions should the government be taking, especially now?
Okay. That's a very, thank you for a very directed question and very relevant, I must say, Ben. Indeed, what is the urgent action now? In fact, the theme is unite, act, and eliminate. That is the theme. We have to unite, act, and eliminate NTDs. That's really the general theme. But now I need to go slightly back. Allow me to go back to the counties.
Yes.
What my colleague has said here. Apart from the national level, the counties have to take responsibilities. These diseases are not, they are there where the people live. Every county should take the challenge to know, what is it that I have in my county? What are the conditions that I have? What are the people who suffer in my county suffer from? Some counties, it's not all that have the same conditions of NTDs. Some have schistosomiasis and so transmitted helminths much more. Others in the coast have lymphatic filariasis and schisto and others. Others have, like in the north, they have Kalaza and trachoma. The country has a map.
Yeah.
Let's create a map to see which are the conditions where they found. It is now up to each county government, the county plans, to come and say, for us, this is what we'll deal with, and we put it in our plan to address it. So that is where take responsibility, accountability, and put it in the budget. And I believe my colleague has alluded to that. What do we need to do urgently now? Urgently now, unite. We cannot eliminate this without all unity in action. Yes, as I said earlier, there are strategies. One of the key strategies, for example, elimination, is availing the medicines that are required for mass drug administration. But that's not the end. We have to continue sustaining the gains by engaging communities, putting sanitation, water, education of how to prevent. Some of the conditions are vector-borne. For example, visceral leishmaniasis or Kalaza. How do we manage these vectors so that people don't get exposed to get bitten by these which carry the parasite? So unite in all activities. Where we have to push the end, let us unite in resources, in knowledge, in coordination, and in maintaining the gains that you have made. Because we can go back. Yeah. People eliminate a condition and they say, oh, we are relaxed. It will come back. We have to continue doing what we have to be doing correctly. And then finally, educate and engage communities. That is so. In fact, NTD cannot end without community engagement. They are the ones even who deliver the medicines to the household. It's not the nurses and the doctors. It is the village community volunteers and the community promoters who take the medicines to the village, to the household, and they give the child there. You see, they are doing their part. Let us engage to end. Thank you.
Allow me to build up on that in regards to funding of NTD programs. A practical example, we have World Health Organization, which is not a Kenyan body. We have WASH, which is not actually a Kenyan body. We are over-reliant on we are more dependent on donors than we realize, especially in the northern part of Kenya. What risk can we run if we have donor fatigue? We are not hoping that any one of you is going anywhere, but we saw in the case of USAID, it just came and went. If at all there's donor fatigue, then we can claw back the gains that we have made, especially now that we've given ourselves up to 2030 to do away with these diseases.
Thank you for that. I think that is something that really needs to be amplified and shouted about, because we have learned a lot of, I hope the counties learned and the national government also learned a lot of lessons from what happened with the USAID programs, because we were so reliant on what was given to us to a point where budgets were not being allocated even to basic services and interventions. So from those lessons, we are, as much as possible, letting it sink in that this is not an NGO or donor support responsibility. It is the community and their leadership responsibility. And even for the program that's running now, we have started the transition so that as much as we've been doing these programs, the communities and the leadership have to take responsibility. Because we could wake up tomorrow and everything has stopped. So what does that mean? Especially for the marginalized, the vulnerable, the ailing, the old, the elderly. So communities need to take responsibility of everything, and we try as much as possible to involve them from the beginning. From the time we are starting the programs, the planning, the implementation, evaluation and monitoring, so that they are part of it and they feel that this is our program. I want to give an example. There's a time latrines were being constructed for communities, and you could go to a community and find the latrines are not used, not because they do not want to use them, but because they think it is a donor or an NGO responsibility. Yes. So when you go to talk to them, they tell you, hii ni choya, it was given to us, but it's not ours. Someone gave it to me. So I do not understand the importance of having that sanitation facility. But if I construct it myself and I understand why I have constructed it, then I take it upon myself to ensure it is properly used, well maintained, and ensure that in case it fills up, then I will be willing to construct another one. And I even, when I'm doing my budgets, I allocate a certain amount for sanitation facilities. On the issue of hand washing, we may think it is easy because we saw during COVID, everybody was washing their hands. But after that, we went back to our normal practices of not washing. And the ailments came back. We have evidence that during COVID, illnesses had gone down because of simple hand washing. So communities need to understand that it is my duty as a community member to ensure that me and my family are safe, so that when the community is safe, the county is safe, and the national government, and at that national level, then everybody is safe. Yes.
Maybe you can touch on that, because at the end of the day, we might run out of
Fine.
ideas
Okay.
because of only following
that. Yes, I want to agree very much what you have actually related to, Ben. The funding of programs for elimination of NTDs, mainly, even globally, have been driven mainly through partners and external resources. There is also national resources. What we are speaking now with the experience which you have seen of, drawing back the funding to health from the, we see what happened from the USG, but also other partners are pulling on health funding globally, not just here. It's the whole global platform. The lesson that is creating is that sustaining these gains have to have domestic resources. And these domestic resources are both national. We must put in national resources into our budget through the treasury all the way to the county treasuries, all the way to the communities. That's number one. Two, which I want to highlight here mostly, integration. Let me emphasize that word. We no longer can deliver the elimination of NTD through what we call specific vertical lines. Like, okay, this is a program, is funded all the way to the community. It's no longer the business. The new business now is integrate with any other sector. In fact, most of the NDD intervention could be delivered even through Ministry of Education. We are delivering medicines to schools. That is an integration through Ministry of Water, through communities. Integrate as much as possible because communities are there. Even it could be another program that is reaching the communities. How can these medicines be? I've seen an example in other countries where actually a program, even in health, you combine another program and you combine them together. You have the vaccine, you have the NTD medicine, you have the net for malaria, all combined to deliver to the communities. Integration is the way to go, and the domestic funding. Thank you.
Now, since we are looking at that, it's a good thing you've already answered that, because I wanted to ask how has devolution strengthened or weakened Kenya responses, and why are we, some counties are doing far much better than others, and especially if you look at wash programs. I've been to the northeastern Kenya, and they're doing a tremendous job there, because from water tanks, branded wash, whether you can wash your hands, to schools as well. How much can we push as, you know, a collaborative effort? Because it's a good thing that you've mentioned that the three things can be done,
yes,
in terms of nudge, in terms of drug administration, in terms of other factors as well. How did multi-sectoral approach?
Yes, that's a very good point. Yeah. It's not a new, but it is, we have to learn to do it. I think it is a change of mind and mindset that we can actually do things together than having to do things separately. I think it has to start from the mindset and also Sarah. I mean, the strategy for integration is now coming in the health sector and with other sectors. So I think it is something which is on the table, both at the higher level, at WHO, that let us integrate for sustainability. We can no longer do this business alone of single deliveries. No.
Yes. And, yeah.
I wanted to add that even at the county level, it has to be a deliberate decision that departments work together. It is no longer business as usual where everybody is pulling to their side.
Yes.
It is not a competition. It is a complementarity approach, where people pull their resources together, may it be human resources, finances. When you bring your cards to the table and you plan together, then it becomes easier for you to move together as a team, as opposed to where everybody is hiding what they're doing, like cards, and you're just unleashing what you think can make you move faster, or maybe be more visible. So it has to be a deliberate decision that people see this as a common problem that needs everybody's attention. So the departments, even at the national level, it has to be everybody's responsibility. Yes.
Yes, you wanted to add
just one more point maybe for that. I believe what want to make a change is the demand by the community. I wish the communities to be empowered. One time I was in one of the villages, I don't have to mention the county, and the communities asked, but why are we being called for this? And next week, we're being called for another intervention. We can all come together and receive the interventions together. The communities are asking, think again. We don't want these multiple things. The communities can be empowered to demand, and it can bring the change. Thank you.
Ladies, and because of the interest of time, I want us to look at the day itself, because I'm quite sure both WASH and WHO, you have programs that geared towards, you know, the big day on Friday.
Thank you for that. On 30th, we celebrate annually what we call the World Neglected Tropical Days commemoration, and we do it at 2 levels. There is the national celebration, which this year will be held in Kajiado County. It was selected because of we all know that it's prone to trachoma, and it was given that special attention under the theme Unite, Act, and Eliminate. So the national celebration will be in Kajiado, and it will be, the guest of honor will be the CS for health, and of course other high-level dignitaries will be attending, the governor and the county leadership. Then in the counties, we are celebrating it in the 4 Western Region county. We call them the DIF counties. That is Trans Nzoia, Bungoma, Kakamega, and Vihiga. So we have what we are calling the build-up activities. So these are activities that are done from the grassroots level so that nobody is left behind. It is not about the D-Day celebration. 30th is the commemoration. But then we need to have activities at the sub-county, the ward level, the village level, where everybody understands that it is a common duty for us to work towards the elimination. So we have activities that are started yesterday, they're happening today and tomorrow before we get to the D-Day, that is Friday. So we have health talks, both in communities and schools, and then we'll have radio talks. There's the local radios that we use to be able to pass these messages. And in most cases, we even do it using a language that the communities understand, the local languages, so that we simplify. If you go to the village and talk about schistosomiasis or bilharzia, they may not understand. But if you use the local dialects, then they identify with that and they're able to understand what you're telling them. Then we have demonstrations, for example, for hand washing. So we have areas where the CHPs, community health promoters, will go to the households through the house-to-house campaigns. So they show practically what we are talking about in terms of hand washing. They're the steps that are recommended so that hand washing is proper. And we also have the house-to-house visits. This is mainly for that demonstration and also to be able to identify people that we may have, for example, with jiggers, but they're not able to access the centers for the treatment. And partners are coming on board to support each other in the treatment, in things that we can do, even in sending the messages to the community. Awareness creation, and for everybody to feel involved so that the community embrace these practices that we are doing towards elimination of the NTDs. Yes.
Dr. Joyce, what exactly are you doing as World Health Organization, especially in the run-up to the D-Day?
Okay, first of all, for the World NTD Day was created and established by the World Health Organization. So that is one of the major things that is to recognize a day that will highlight the milestones and what should be done for the neglected tropical diseases and for the people who are suffering. So that is one of the key things WHO has done. Apart from that, we are also giving, of course, support in terms of the theme, right? For example, what are we concentrating on? Bringing together all the partners who will deliver the ending of this roadmap. It's one of the things also for us to remind the policymakers and the countries of the roadmap. We are now already starting the second leg of the roadmap. Are we going to meet there? We have to remind ourselves, and WHO has to keep on reminding us, we have a roadmap to make. What are we doing? Are we putting resources? Where are we? Where are you in your milestone? It is our work to remind them. Are you on track or you have lost track? Where are the communities? So our role as WHO is to keep the government and the partners on track to the roadmap.
And now, still on the same, and I want you kindly to answer this question, the two of you. What message you have for policymakers, county governments, I'm talking about even the national government, bearing in mind that health is already devolved and we are having a number of challenges, and how can ordinary Kenyans, wherever they are, contribute to ending NTDs in their communities by the year 2030?
Maybe I start from the national and the higher policy. I believe this is a time for all the national, when I talk about national, it is all the the government and their partners and stakeholders to actually open our milestone and reckon and evaluate. And we have moved, this is 5 years, we are at the midpoint, and are we really there? So to me, I am saying, let us take stock and see the milestone. So that's the message to the policy makers. There is message to the governors and the counties the same. On your county level, are you on the calendar? What's your map? Are you falling behind? Or other counties, the other counties that are pushing better than the others because they have put investments, they have put targets that we must get rid of this condition from our people. It's also time to reckon. Communities, I believe you can talk about the communities. They have a role. They also don't want to be left behind. It is them who are affected. But as I said, deliveries of these interventions are through communities. So the community's role is that for example, how many people have been targeted this year, and will you target, and will they going to reach the target towards ending NTD in your county? So all of us have a role. Nobody will be left behind. Over to you.
Just to add on that is that communities need to call out their leaders to accountability, because their budgets and funds allocated towards support in the elimination of these NTDs at the county level. So they need to ask questions, because if this money, for example, is not used for improvement of water, sanitation, and hygiene, then we need to ask questions on what is happening to this money. These budgets need to be allocated to the correct intentions. We've had situations where budgets are allocated, but then later they are moved to other activities because NTDs are not treated as important. And that's the NTD title, because they will remain neglected as long as no accountability is asked. And then for the community, they need to understand that these diseases are treatable and preventable. We do not have to have the mass drug administration every year. We do not have to wait and think it's a way of life for the MDA to be there. Simple practices can eliminate this. And also the issue of stigma. NTDs are not a curse. They are things that, ailments that can be treated, and social behaviors that can be very important in the elimination of these NTDs. And also talk to each other, have community dialogues, so that we bring everybody on board and no one is left behind. We may think some people are not important, the youth, the children, women, everybody has a part to play. So let everybody be involved. It could be in a small way, but at the end of the day, those combined efforts go a long way in the elimination. Yes.
Dr. Joyce, again, I'm back to the counties because health has devolved.
Yes.
And has devolution strengthened or even weakened the fight against the NTDs? And how is it that some counties are doing better than others, and why?
Good. I'll try. I hope the national program will also answer that. But I believe devolution has contributed greatly to strengthen health deliveries. Definitely it has, because you have moved the services to the people. But what is the catch here is each county then should ask themselves, because that's where the gap is. You have given the power to the county governments, but they have to make the decision to prioritize it. But what we have seen, and I don't want to be shy, what we have seen in some of the counties we are mentioning is that sometimes the NTDs are sometimes even again pushed aside. Because we have to focus on these other conditions. And yet they know that this neglect recall disease is something that you can eliminate. Already you have the medicines already provided for. What you need to bring in is resources. So I could say devolution is a big opportunity, yes, but it requires to be recognized and appreciated that it's an opportunity to even end the NTD in your county if you put resources there. So what we need to do, and maybe need to be done a gap, is going down to the counties and say, I was asking, actually, we are working with the national program to have what we call county profiles. It's already happening. For each county, this is what I have, this is my picture, and this is where I'm going. Every county should have that map and the compass, and saying, I am ending NTD, or are you not ending? So that is the difference. Some counties have done very well, and like the DIF counties, and they have even put money within their CIP, the county development plans, and others yet to. So this is a challenge, but I think it's a call for all the county governments to actually end NTD within the area.
And we will. Allow me to just take a quick break, but we'll be right back. When we come back, we'll be looking at the role of the youth, because we have seen some cleanup exercises. Many people don't realize that this can be a game changer. How can they be involved in actually helping out in the fight against NTDs? And how can we change the cultural silo mentality, where you find that people with jiggers, elephantiasis are avoided and shunned by the community? You're watching KBC News Check. Many thanks for keeping it right here. We're taking a quick break, but we are talking about NTD, which are neglected tropical diseases, and how to end them. This Friday, we commemorate the World Neglected Tropical Diseases Day and the action plan, which is the action plan. That is what we are laying it bare right here. Let's take a quick break. We'll be right back.